I wanted to speak about this area of diabetes psychology that's somewhat of a specialty area. Not everybody knows about it, and I want to make sure that more people are aware of this particular resource. Just because there's so many feelings that go hand in hand with managing a chronic illness like diabetes that it's rarely talked about. The emotional side that's really rarely talked about, that there is more support available for, but we want to make sure that just like we're trying to make sure insulin is available, that we're also providing this emotional side of support through the healthcare system. And of course, there's going to be lots of need for healthcare reform before even that is possible. My name is Dr. Harpreet Nagra. I am a diabetes psychologist. That's the official label that I go by. I have a doctorate in counseling psychology, and a lot of my training was focused in health psychology, but I specialized in diabetes, partly because I have family members and friends who, I don't have diabetes myself, but I've seen the emotional struggle that folks go through in the day-to-day management of diabetes that's rarely talked about. So as I was trying to figure out what I was going to do with my career, I really wanted to select a specialty where there wasn't as much discussion, there wasn't as many resources, and diabetes is that, at least from my end of things. I'm currently working as a diabetes researcher at University of California in San Francisco. What this means, what we're looking at is a little bit different than what you all may have heard of in terms of diabetes research. We are looking at what are the emotional interventions, psychological interventions that we can be providing to folks to help reduce some of the, again, emotional and behavioral challenges that come up with managing diabetes on a day-to-day basis. I see about 10 to 15 folks on a weekly basis that are managing either type 1 or type 2 or MODY or late onset diabetes, like all of those different variations, as well as for some folks managing a mental illness in addition to the diabetes management. So I'm very privy to sort of a lot of the examples that were shared already. And I want to make sure that as a professional who has tools and skills that I can be providing to clients and folks living with diabetes on a day-to-day basis, that more of us are talking about this and available as a resource to the general public, because this should not be a coveted service that's only available to the elite in some way. And then by doing that, actually, I'm also working as a faculty member just because I want to be teaching the next generation of mental health providers about the importance of conditions like diabetes and the impact that they have on not only just the physical side of things, but also the emotional aspects of everything that comes with it. So I try to do my best to be an advocate in all of those directions. So I want to just do a quick survey of everybody that's here of how many of you actually knew that diabetes psychologists existed. So again, this is a service it's not newly available, but I think it's been kind of denied to a lot of medical settings because, again, mental health is not considered as available or as significant as physical health. But we all know that when you're feeling stressed, that impacts your physical health and the way that you're able to take care of yourself and so on. And we'll talk about the impact of the various emotional factors on diabetes today.
And Dr. Nagra, just so that you're aware, the chat function should be open for this part, so people may be responding there as well.
Oh, perfect. Yes, I did see that. Yeah, I'm seeing some responses coming through. Thank you for Allison, to Allison for following me on Instagram. And we'll talk about that as well. Yeah, so there's not a whole a number of resources that are available. So let me just start out with the basic function of what diabetes psychology is. So first of all, there's the general psychology that's out there. So general psychology will look at how are your thoughts, how are your feelings, how are your beliefs impacting the types of actions that you take on a day-to-day basis, right? So that's general psychology. That's what a psychologist can provide support around. When we're talking about diabetes psychology, we're looking at how your thoughts, feelings, beliefs, actions impact your direct relationship with diabetes, so your health outcomes. So things like your day-to-day engagement with diabetes tasks, or your A1C, or the sort of your willingness to talk about diabetes with others, how it might be impacting your relationship. So every sort of emotional impact that we can think of, I'll give more examples as we go through, it allows us to process some of those ideas with a professional who can, again, provide additional tools and skills along the way. So simply put, it's the emotional and behavioral side of diabetes that I would say not a whole lot of medical professionals are privy to also, because the focus has been, and there is a lack of training on the emotional impact on physical health over time. So some of the common psychosocial concerns that I would help provide support around for anybody who would come in to see me include things like adjustment and acceptance to the diagnosis. When you're first diagnosed, I mean, you all have been, I'm sure, aware of all the variety, the flood of emotions that come on once that occurs. So the idea of managing the shock of receiving the diagnosis, the grief around the diagnosis, the potential role change shift that might happen for you once you receive the diagnosis, the changes that it lends in your relationships, in your work environment, in your school environment, if you're a young kid. There's just your life shifts in so many different aspects that are rarely talked about. And a lot of folks, whether they're coming to see me immediately after they've been diagnosed, or if they're coming to see me after 50 years of living with diabetes, not everybody is at the same level of acceptance of the diagnosis. There are still folks who might be 55 years in and may still have challenges in just accepting the fact that they have type 1 diabetes, and just the diagnosis and just sitting with it. And I think what tends to happen is that when there is a lack of acceptance, and I'm not blaming the folks who are living with it, because I think this is such a challenging experience to be dealing with on a day-to-day basis. When there is a lack of acceptance, though, it prohibits us from making the physical changes, the behavioral changes that we might need. So the habits that we might need to put into place to be taking care of ourselves on a day-to-day basis. And sometimes if you don't know anybody in the community, as they were talking about in the previous session, you feel alone. There's isolation. There's possibly a sense of shame. There's possibly a sense of guilt of why did I get this diagnosis and how did I get it? And that when a lot of your energy, emotional energy, is spent in managing those emotions, then the day-to-day diabetes tasks, I think there's about 150 diabetes tasks that are necessary to sort of just maintain your diabetes, that get in the way of allowing you to really fully pay attention to those diabetes pieces, because the emotional impact is so great. We also talk about diabetes distress. So this is what I was talking about with the 150 tasks. That's not a research number, but it's something that's been out in the clinical diabetes community that we often talk about, that, in a given day, if there are 150 tasks that you have to complete just to manage your diabetes, you're not going to have a whole lot of energy, emotional energy, or possibly physical energy to devote to other aspects of your life. And even if you still muster up the energy to do so, it's very challenging to make that happen on a consistent basis, every month in, day out, for multiple years on end. And that is where a lot of diabetes burnout tends to happen as well. So burnout can look like wanting to step away from diabetes altogether. So feeling like if you can't give it 100, give it 110% of your energy, that it's not something you want to do at all. So a lot of folks tend to end up with some like perfectionistic types of thinking. So going from wanting to do either 110% or nothing at all, or 0%. And that shifting, that going back and forth, can also, again, be wearing on you. Perfectionism, like I was saying, comes up quite often. There's, again, a lot of messaging that you're getting either from the healthcare system, from family and friends, your own internal sort of early childhood experiences, early life experiences that are saying, if you're going to do something, you should do it to your utmost best ability. And if you're not, then, you are not doing it right, or, you're doing something wrong along the way. So what we do is we talk through what some of those perfectionistic pieces might be for the client, and how to go about making some changes that are appropriate for you, that are personalized to you. Again, I've been talking about coping with diabetes within relationships. So, I have a few clients who have shared with me that, when they first were diagnosed and they were dating somebody new, they were terrified about sharing their diagnosis with their partner, this new person that they had been dating, because they were worried that the person was going to turn around and run away and say, they can't be in that relationship. So that in itself can be traumatizing as well. And it can, again, make you want to hide your diabetes diagnosis even more so. So it's something that I think we don't always acknowledge, again, the day-to-day or the minute-to-minute changes that are happening for all of us in terms of how it might be impacting our relationships. Navigating the healthcare system. I know that a majority of this workshop is going to be focusing on how do we better improve the healthcare system to make sure insulin is a regular resource that's available. In addition to that, I think mental health is a significant part that's missing from the conversation. Insulin is absolutely, this is something I always say, insulin is absolutely the treatment for managing diabetes, but it doesn't help you cope with the emotional weight of managing diabetes. And that is where we need more support, more mental health professionals in the clinical settings immediately after the diagnosis is made, to let people know that they're not alone in their experience. They're not isolated, that there is not only a medical team, but a mental health team that's available as a resource. And how can they be talking, and what kind of communication skills do they need to be developing for themselves? For the support team that's available to them, to have more of these conversations with their family and friends. There's so many folks that I sit with in my office who say, I really want to be able to share and seek out support from my family members and my friends. However, I know that as soon as I do that, they're going to start nitpicking, or they're going to start policing what I'm doing, or they're going to possibly invalidate my experience, or they don't truly understand. It doesn't feel safe for me to share some of this information. What I'll say from the psychology world is that we know that the best way to access healing is through community. We are social beings. We need social support in order to even amplify our healing to some extent. And if those types of challenges are present, I would want somebody to have that mental health resource, at least for, even if it's a temporary time period, to be easily accessible to them, so they can process whatever feelings might be coming up until they develop the skills. Or, we bring in family members to help the entire family talk about the diagnosis, so there isn't this sort of one person shaming that's happening along the way, to collaboratively think about what are the skills that are missing for this group. How do we continue to talk about some of the challenging aspects of taking care of diabetes and dealing with burnout as a community. Additional areas that we might be that you can focus on with the diabetes psychologist include things like carb counting or eating distress. I have many young women who come in, even young men who actually, age has nothing to do with it, to be honest. Because diabetes, you're constantly thinking about every plate is a math problem, right? So you're constantly thinking about carb counting and the carb to insulin ratios. There's a lot of distress, a lot of possible disordered eating that can develop from that as well. So these are just some types of concerns that are available to talk about when it comes to discussing diabetes and the emotional impact of it. I see some really great questions coming through our chat feature here, and I'm going to take some time at the end to answer all of them. So just hold on tight. What I do want to say is that what I want to focus on for today is the difference between diabetes distress and depression, because I think a lot of times there's utmost confusion about, oh, you're just depressed, that's why you're not doing whatever you might need to do with your diabetes tasks. That is completely untrue. While some folks are managing depression types of symptoms, diabetes distress and depression are two separate things. And the reason we know this is because whenever we have done research studies to look at the impact of psychological interventions or any type of emotional intervention on a person's level of emotional distress around their diabetes, we've seen very quick changes around A1C levels, which I know everybody is probably sick of hearing, but that's what the healthcare system uses to measure whether or not something is effective, right? We've seen changes around A1C levels. We've seen changes around blood sugars. We've seen changes around how how folks are managing their stress levels on a day-to-day basis, how they might be engaging with again, the diabetes related tasks. So how often they're checking their blood sugars, how often they're bolusing, how often they're carb counting, what kind of tools they're using to carb count. All of those pieces shift whenever there is just this simple acknowledgement that diabetes distress might be at play here. The sad part of all of this is that a lot of folks are either unable to or don't realize or are unaware or just don't have the resources to, again, access those mental health services until they hit a point of burnout. That is when medical professionals will typically say, okay, maybe you should go see somebody. But there's so many things that we can be doing on the preventative end that could allow folks to truly sit with and acknowledge the distressing feelings that are coming up and acknowledge that this is a hard thing to be doing. It doesn't have to be that something that you just kind of hold on to and kind of internalize for yourself and end up kind of beating yourself up about over time. Diabetes distress, because it can be chronic, that is a significant factor here that differentiates it from depression. Depression, the treatment for depression, versus the treatment for diabetes distress, they're two different things. A psychologist typically, the gold standard for depression is typically, in terms of treatment, is typically a combination of medication, if appropriate, as well as some type of talk therapy. And there isn't exactly a gold standard just yet for diabetes distress because there is such a lack of acknowledgement of it so far. But what we're noticing is that simply engaging in some level of talk therapy is helpful for a number of folks out there. So when there is acknowledgement, we see changes in adherence levels, we see changes in quality of life, we see changes in relationships, and everything else that I've kind of mentioned so far. So I'm getting ahead of myself, folks. One resource I really wanted to mention as part of this talk, because there are a number of advocates out there that might have access to more folks who are possibly experiencing diabetes distress, is called the Diabetes Distress Survey. I had the link here, and if these slides are available, I'm not sure if they are or not. Please feel free to use this link from the slides. But you can also just Google Diabetes Distress Survey and you'll be able to find it. This particular survey helps you. It was developed by psychologists. So if any of you are familiar with diabetes psychology, you'll know names such as Bill Polanski, Larry Fisher, I feel like those are the sort of two most common ones, but Bill Polanski is the guy on diabetes burnout within the psychologist world. But they were the key researchers who developed this particular survey after multiple research studies. And what this particular survey allows you to do is identify what aspects of diabetes distress are you feeling most distressed about. So it'll ask questions such as, I don't feel skilled at managing diabetes as much as I think I should be, right? Or I feel like I don't eat as carefully as I probably should. So these types of items are assessing 7 different types of diabetes distress that exist, or that we've labeled thus far in the diabetes psychology world. And these are the 7 types of diabetes distress that one could experience. So, for example, powerlessness. I don't know how many folks I've sat with who just feel discouraged about their diabetes, who feel like they're getting such negative messaging on a regular basis from doctors, from different sources, saying that you're going to develop complications no matter what. Or let's say 20 years ago, folks were getting messaging 20 years ago, 30 years ago, even 10 years ago, that now that you have this diagnosis, you are basically not going to either, you're going to experience tons of negative outcomes, not be able to have children, lose limbs. You all know the complications. You're already distressed about them, so I don't need to review those. But there's this feeling of, no matter how hard you try, you're going to end up with negative consequences no matter what. And that sense of powerlessness is a sort of this meta feeling that's there all of the time. It influences every aspect of how you engage with your diabetes. So the next time you might have a high blood sugar, if you're feeling that sense of powerlessness, you're possibly going to say, why should I even treat this? Or do I even, is it even going to matter if I give myself the correct insulin dosage? Or again, no matter how correctly I counted my carbs, I'm still going to have complications. So why would I even continue to make an attempt, right? So that sense of powerlessness starts to dictate your day-to-day actions around diabetes. That feeling guides your responses. Other types of distress might include management distress, so feeling disappointed with your self-care efforts. I don't know how many folks I've sat with who said, I counted my carbs as thoroughly as I possibly could. I gave myself the correct dosage of insulin, and my blood sugar was still high, right? And I didn't know what else to do other than just sit there and wait. Or I didn't know who to reach out to because, I don't have, again, access to the appropriate resources that could potentially walk me through or talk me through what to do in that situation. There's very much unfortunately, I don't want to sit here and bash the healthcare system, but I do think there's lots of gaps that we're still missing when it comes to chronic healthcare for chronic illnesses. And that includes things like being able to provide 24/7 on-call type of care for folks who are managing diabetes for the first time. There's very much this mentality of fight or flight. You just kind of sink or swim, do what you need to, call us if you have any major problems. And you don't want to end up in the emergency room every single day either. So that type of management distress can get in the way, and the healthcare physician distress is what's labeled on here, number 6, can get in the way of feeling like you are properly managing your diabetes as well. Hypoglycemia distress, so feeling like you can't ever be safe. If you've ever had a hypoglycemic episode, you can feel kind of helpless around that, feeling like I don't know when my next low is coming. Or if you know of folks who may have suffered negative consequences from a hypoglycemic event, that can amp up your anxiety as well. There might be distress around how you're perceived by other people, the constant, again, policing that might happen or criticisms that might happen, being worried about going to your doctor's appointment and not knowing what your A1C is, and being worried that they're going to, again, shame you for not having a better A1C. all of those can be quite challenging feelings to sit with. And that I'm just naming minor examples. There's so many examples here that you all, again, may have the lived experience of sitting with that aren't being accounted in even these 7 subscales, because diabetes psychology is still such a, it's basically in its toddler stages right now of development. But again, it's not easily accessible to everybody. Eating distress, similar to what I was talking about earlier with carb counting and so on, that can, again, be something that comes up. Disordered eating or any type of eating disorder. Diabulimia is quite common. There's a number of young folks who've shared experiences with restricting their carb intake or restricting insulin use. That can be something that a psychologist can help with as well. And then friend and family distress, either friends and family focusing too much on diabetes management or too little on your diabetes management. So either over policing or a lack of support. Those are all sources of diabetes distress. So that's what this particular scale can provide information on. And it's a free scale. It's available on the website, and you can just go on and figure out sort of where you might be on some of these, on these 7 subscales that are listed here. And that might also give you an idea of if you wanted to seek out mental health support, what you could talk about with that provider. So as we wrap up, because I know we only have a few more minutes, I wanted to share just quickly some strategies that have been known to actually make changes in diabetes physical health outcomes as well as emotional health outcomes. The first is self-compassion. So recognizing that diabetes it's hard. Just sitting with that idea, I think it can be healing in and of itself. You're not doing anything wrong. There's nothing wrong with you. The idea of having 150 tasks to manage on a day-to-day basis and having to do that day in, day out just to keep yourself alive, that's hard. We just need to sit with that. And allowing yourself that acknowledgement, that level of self-compassion to know that it's okay if there are some days that you may not feel up to the challenge, up to the task of doing everything. And it's okay that you're not going to do it perfectly either. So allowing yourself the compassion of that this is just a hard disease to manage, but it's okay to seek out support, and others are in the same exact boat with you. And the more folks that you can reach out to who have that similar lived experience, or even professionals who you feel like you have a connection to, the easier it'll be for that self-compassion to come through and help you manage the diabetes physical outcomes just as much as the emotional outcomes. Self-talk, self-compassion, and self-talk kind of go hand in hand, but a diabetes psychologist can help you figure out what are the sort of language changes you might need to make in your and how you're talking to yourself about diabetes that might help you feel differently about it. Mobilizing social support, has tremendous impact on healing. Reframing some of the thoughts that are coming up, or some of the messaging that you've received, some of the stories that you've been told that are now feel like absolute truth, but may just be stories or somebody else's projections onto you about how you should be thinking about some of these things. That is a very appropriate intervention. Then acceptance, radical acceptance is the idea that basically you can sit with the truth of diabetes is hard and it's going to take work, and you can do it, but you might need support around it. And how do you access that support is really the point of change. I just wanted to say that where do you find a mental health provider that focuses on diabetes? So the main resource that I would share with everybody in the United States, the American Diabetes Association has a mental health directory that lists folks who have a specialty in diabetes for different states. If you go to their website and just search mental health directory, you should be able to find it. I'm on Instagram under Diabetes Redefined, and if you go to my profile, there's a link there. The link tree where you can go to different websites. I link the ADA mental health directory there. So you can, that's one easy way that you can do that. Let's see. So that's ADA would be the best resource. There's a few folks on, there's about 8 of us on Instagram who are providing, they're generalized conversation points, but I think still important points to be talking about when we're talking about mental health and diabetes. So there's a handful of us on social media. And then let's see, other resources. Sometimes if you go to psychologytoday.com, that's a website where you can find resources for if there are folks, if there's a mental health provider that focuses on chronic illness, sometimes they also have an understanding of diabetes as well. You can access providers in that way as well. Also ask your doctor, your primary care doctor or your endocrinologist, if they don't have resources available on site, definitely ask them to find resources for you. So that's always an option. Or you can go through your insurance company as well. And they would be able to, at the very least, link you up with a mental health provider. And if that mental health provider doesn't have a background in diabetes, they can be a good way to help you identify others who might have the diabetes specialty. Other common mental health disorders, yes. So eating disorders, like I was talking about, somebody asked what are the most common mental health disorders that you see. So yes, eating disorders, any type of diabetes and mental health concern that comes up, we have to have a specialist who sees who has that background, because so much of your mood is impacted by your blood sugar levels. And unless somebody understands that from the diabetes perspective, they're not going to be able to, from my perspective, they're not going to be able to really provide you with the best tools that are going to impact your, help you understand how your diabetes blood sugars might be impacting your day-to-day moods and therefore possibly contributing to other mental health conditions as well. And sometimes it's diabetes distress, and sometimes it's a more significant mental health condition. So you absolutely need a provider who can do that. If you have, I know there's there's lots of other questions. If you have more questions, definitely email me. My email is right here. I'm more than happy to answer additional questions in detail.